Um, Delighted once again to welcome everyone to February's Health Innovation Community Partnership meeting. And we'll go ahead and kick things off. I just wanted to recognize that today, or pardon me, this week we started we celebrated Lunar New Year, and we are entering the Year of the Tiger. So hopefully, the Year of the Tiger will be full of blessings for you and your family, and we'll be kind of experiencing a lot of wonderful kind of growth and opportunity in the year ahead. As we get started here, I just want to make a couple formal announcements. The first is that this meeting is being recorded, and after completion of the meeting within the next week, it will be uploaded to our website at hicpla.org. Unless you are speaking, please mute yourself and try to maintain that through the course of the meeting. You can see a control panel at the bottom of the screen where you can control your microphone and your video. If you want to see who's in the meeting room, please click on the participants button. We want this to be interactive, so of course you can raise a hand or you can add comments into the chat, and I'll be sure to get to your questions at the appropriate moment. We also want to make sure we have accessibility in this meeting, so interpretation is enabled. Please click on the interpretation link to select the language of your choice. We have a very full agenda today, but of course, interactivity is one of the most important aspects of our meeting. So please always feel free to raise a hand, to put something in that chat, and at certain moments during the presentation, we'll ask if you have questions you'd like to pose yourself. Before we get started, I'll go ahead and read our Health Innovation Community Partnership Guiding Principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious, and seek to understand various points of view. Participants will explain their reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. Looking at our agenda today, it's full of a lot of exciting information. I'm sure you'll get a lot of wonderful opportunities for learning today, as well as asking questions. We'll start with our LAC USC Medical Center update, as always. Then we're going to hear a bit more about campus projects from our colleagues at the Department of Public Works. We'll have an update from the Department of Public Health and the Wellness Center on COVID in our community. We'll have a tenant protections update, a general hospital feasibility study update, a presentation on enhanced infrastructure financing district, and finally, we'll conclude with some comments about the LA City redistricting process. With that, I'm really excited to go ahead and get started, and I invite Jorge Orozco to take the microphone.
Hi, good morning. Can you all hear me?
We can. Hi, Jorge. Welcome.
Good morning. It's always a pleasure to speak to this great group. Just wanted to provide a few updates on our hospital and medical center and how we're doing. I think the overall theme is we're doing much better. Since the last time we talked, it's been a rough month. We've had challenges with staffing. We've had challenges with the volume of admissions. Not necessarily COVID admissions, but just general admissions. And although many of the admissions had COVID, they were not admitted for COVID reasons. I do want to share with the group a dashboard that we look at on a daily basis to kind of track important issues for us. If you look at the upper left-hand corner, we have the number of positive cases in our hospital. That's 123 patients. Of those 123, we have 30 in our ICU. Of those 123, probably only 30% of them are actually in the hospital for COVID. The rest have incidental COVID positive findings. As we found out, someone who has had COVID will probably keep testing positive with a PCR for a median of about 90 days. So it's a long time until the virus kind of clears for you to actually get a negative test. So that's what we're seeing. And this last week, we've seen a significant drop in the number of admissions. If you look at our staff, you look at the number of staff who have confirmed positive tests, about 1,897. Just to remind the group, we have 10,000 employees at LAC USC Medical Center. In the upper right side, we look at our protective equipment. Do we have enough masks? Do we have enough face shields and goggles? And as you can see, our system has done a really good job of keeping our employees equipped with the appropriate equipment. Those are all in green. And then if you go right below that, you look at blood supply, it's yellow. We are concerned about the blood supply, and this is a regional, national issue. We are scheduling a blood drive on our campus. I believe it's February 15th. There we go. So you're all encouraged to show up, give some blood, but also share this with your constituents so that we can have good participation. A few weeks ago, Harbor UCLA actually had to close their trauma service because they ran out of blood. And so this problem is very, very real. And so we need to encourage participation in that. Our medication supply is good. If you look at the bottom, that's our hospital census is 458. Our number of emergency department visits, 396. And then the number of patients who have had COVID and are admitted for COVID, but have been discharged and in a safe way. And that's 4,688. So we've had significant number of folks come through our hospital. Let's see, what else? We go to the next slide. Were we going to show this video?
I'm not sure, Jorge. Connie shared it with me. We're happy to put the link in the chat if we want to do it that way instead.
I'm not sure how long it is.
It's about 2 minutes.
Yeah, probably not. So we could put the link. This is, we have our weekly town hall meeting where we have our physician specialists talk about kind of how it's going. So this is a great update and encourage you all to have a chance to look at that. And then finally, I want to share, I think there's a slide about our nurse, Sandra Shells.
Yeah. Oops. Oh my. Yes, there is. Let me get to it. I'm trying to get out of here. Oh no. Okay, escape.
As you know, as all of you might have heard in the news, we had really tragic situation and passing of one of our beloved nurses in our emergency department, Sandra Shells, who was on her way to work. She was taking public transportation and was assaulted and subsequently passed away. And this was a shock to our entire staff and also to the community. There's been so much support after this incident. And I just want to recognize our foundation, our LAC USC Medical Center Foundation, for establishing a fund to help the family, but also to help victims of violence. And there's a link there if you all want to contribute or pass that link along. That's that would be appreciated. We have had several memorials, but there are plans in the way to have something more permanent on our campus, and so there's a group that's going to be looking at that. And with that, I ask if there are any questions.
Does anyone have a question they'd like to pose to Jorge? Well, sounds like you might have covered everything that was burning in people's minds. Jorge, thank you so much.
Thank you all.
You're very welcome. I do see in the chat that I think it sounds like we're having some trouble with translation. I'll ask some members of my team who can look into that for us. And then a final reminder, of course, as Jorge mentioned, there is a critical blood shortage across the county and the country, in fact. And so it's been a challenge, of course, with COVID to have people come out and donate blood. But LAC-USC is hosting a blood drive on Thursday, February 15th. And we encourage you, if you're available, to please go out and donate blood and get the word out to those in your community who might be able to do so as well. That will enable our campus to come back even stronger in terms of providing those life-saving services that we all rely upon so much. Next up, we're very delighted to welcome back again Alicia Ramos from the Department of Public Works to share with us campus project updates. She is joined by her colleague Esther Diaz and Rosa Soto. Alicia.
Good morning. Thank you, Heather. Yes, and once again, my name is Alicia Ramos, and I'm with LA County Public Works. For those of you that have been very consistent at HICP, I'm sure you've seen me in the past. So what I'd like to do is take you through an update on our campus projects, some of our more notable campus projects, and then I'm going to also touch on the community involvement before we end, and then I'll share some news at the end. So appreciate if you could stick with me through the presentation. So let's go ahead and get started. If you could, Heather, next slide. Okay, update on our courtyard renovation elevator addition project. In front of you, you see a conceptual drawing because we don't have it built yet, but we are adding 2 elevator cabs so that the transition from the upper plaza to the lower plaza has some options, especially for those that may be in wheel-bound devices, strollers, wheelchairs. So we are currently under construction. Next slide, Heather. Next slide. There you go. Okay, this is an overview from the top, again, conceptual drawing of what that project is going to accomplish. So we'll have a ramp, you can see towards the upper right, that will lead you to the elevators, and then you have the option of taking an elevator instead of all the stairs that we've had and that very extensive ADA ramp. Next slide, Heather. So we've completed all the major demolition and the grading, and what we have going on right now are the foundations. So you're going to see a very active construction site on campus if you haven't already seen it. And our expectation is that the project will end this summer, about August. Next slide, please, Heather. Okay, this one is the Women's and Children's Hospital demolition project. We have demolished the Women's and Children's Hospital structure. It's been down for some time now. And what we're doing is we are backfilling the lot so we can bring it to an even grade. And then that'll be sort of vacant for the time being. It'll be used as potentially optional interim parking. We expect that the area will probably be down about 18 months to 2 years while we get ready for the next phase of Restorative Care Village. The next phase of Restorative Care Village that'll sit on that site, we expect to have some mental health program components. And then we're leaving space for another mental health component, which will likely be a 200-bed inpatient tower. So what you see on the screen is a layout of that space. The orange area to the bottom right is the current phase of Restorative Care Village, which I will go through before we conclude today. The green area is what I'm speaking to, where Women's and Children's Hospital used to be, and that's where we're focusing for the new developments. And then across the way, you'll see in the blue an additional phase where we are going to be demolishing the current child care center after our new child care center is complete. Next phase or next slide, Heather. Thank you. And here's some images of what the site is looking like. You won't see it from this perspective. When you drive by, you'll basically see a fence that's still up so that we can continue to do the grading activities. And then once it's down, like we said, it'll be a finished grade. Next slide, please. Another image. Okay, next slide. Child Care Center. So I had mentioned the demolition of the existing Child Care Center will happen once this project in front of you, the new Child Care Center, which is right off State Street, once that's complete around May of this year. So previously we had the Child Care Center off campus. One of the big benefits to this new construction is, one, it's a new facility. Very excited for the play yards that are going to be available, as well as the buildings themselves to the children, but that it's here on campus. So we're hoping that that's a much more accessible, convenient location for many of the parents that are using the Child Care Center. Okay, next slide, Heather. Thank you. Okay, and I put Restorative Care Village Phase 1 towards the end here. So I want to show you all the progress that we've made here. We're essentially at the point where we are filling in the courtyards in between the buildings. The buildings are complete. We're putting in the hardscape, as we call it, which would be sidewalks, concrete plazas, the landscaping, the planters, the outdoor seating. All of that is coming together to complete the site. So we're approximately 95% complete. We're really at the tail end. We are expecting to complete this project this month. So we're very excited for that. And we know that there's a lot of excitement behind the project. Next slide, please. So here are some images of what we have there on site, some images of the outside of the buildings, some of the interior. Next slide, please. Again, some more images of the interior. I mean, really, it's come together nicely. And we're very hopeful that these facilities are really going to make a change, not just for the medical center campus, but really throughout the county, in helping us address that gap in services that we see when we have folks who have home care network challenges. They come into our medical center, they're treated for acute problems, and then when they're ready to go home, that's a challenge for those folks who don't have that stable housing. And this facility will give them that opportunity to have a stable housing situation, to have a care network available to them, so they can go on to successfully recover and hopefully stop the cycle of coming back into our emergency rooms, where it becomes very costly. But it also is not the goal. That's not the way the healing process should continue. So very hopeful for this. So I want to leave this image up here because the Restorative Care Village really is a manifestation of all of the community effort that went into this project. I really feel like Restorative Care Village was such an opportunity, not just for our department, for the county, but I think for the Med Center. And I think for the overall effort of bringing community more involved into this process. Heather, I'm going to ask you to go to the next slide, please.
Oh, and before we leave, Alicia, we do have 2 questions in the chat, and I thought maybe we could take those now. The first question is, have the hours of operation been determined for the Child Care Center?
Oh, my belief is that the hours of operation are to remain with what they currently are, but I would need to verify, and I can do that, Heather. Let me verify what those current operating hours are, but we don't expect that it would be any different.
Thank you, Alicia. And the next question is, has a date been selected for the Restorative Care Village groundbreaking?
Great question.
Sure, yeah.
Well, groundbreaking we did, but for grand opening, I think that's probably the next step. And I think it's a fantastic question. Yeah, the ribbon cutting, the grand opening. It's a great question because there's a lot of excitement for when we get that chance to celebrate this. So a date has not been selected yet. We will certainly keep HICP at the center of that so that we can put the message out. We can coordinate with that. But I do expect that we're probably going to be looking at possibly sometime in spring. But again, we'll keep everybody informed with that event.
And I just want to recognize some advocacy in the chat from Teresa Velasco for the need for night shift employees, need for childcare. So rethinking those hours. I know that's not in your plate, Alicia, but just a comment for the group. All right, so we'll move on to the next slide.
Yeah, we can certainly express. Yeah, we can certainly express that desire when I reach out to Director Francis we can express that interest. So yes, next slide. So I have this slide in here because I really want to reflect on what this restorative care village phase has done for us. It really has brought together, in my perception, the community in this design process, this construction process. And I want to take the time to really thank HICP for the partnership that's been provided. And goes without saying, the community interest has been such a huge factor in this, that you all come here on this monthly basis, that you participate in these processes, that you've expressed you want to be a part of this process, has made the difference between in the past how we do projects and how we endeavor to do projects now, is to increase that community involvement. So thank you all for your interest there. I want to thank the HICP leadership, because without that leadership, it is such a difficult task to get community together. But that you have this forum, that HICP can be this resource, you've really made it especially strategic and helpful for us, Heather, Rosa, to all of the HICP community. This has been a fantastic resource for us to reach out and know we have a conduit directly to the community. And it makes it a quick thing to put together. It makes it a very effective communication. So I just want to reflect on really what a game changer that is, and let you folks know that you really are ahead of the game here, that you've got this organization together. I think you're going to see a lot of communities wanting to model themselves after this, because it has been such an effective tool. And I want to thank you all for the collaboration. And I've placed here at the bottom the standard for the future, because as I said, I think you're going to find that this is a model that a lot of folks are going to want to establish for themselves. So the reason I'm going through this is because as we come to the end of the Restorative Care Village, I want to acknowledge all the help that the community that HICP has put into this. I want to thank you all for the time that you've sacrificed in your own personal schedules, the Saturdays, the evening meetings that we had going through the design process, through the civic art. You really have made a difference in this process. And I can't say thank you enough from our department, and I think for the county in general. And the reason I'm saying that too is because there will be some changes. So as I noted earlier, we're going to come to some change here that I want to note, and that is that my time at LAC USC is coming to a transition. I'll be heading over to the Harbor UCLA campus, and you will have Esther Diaz, my colleague, here heading up the LAC USC campus projects. And I want to let you know that you're all in good hands. Esther has been doing healthcare projects for a number of years in her career. She comes from the Harbor UCLA campus. She comes from MLK. She's dealt with a lot of the medical campus sites, so she's very well versed in this. And I'm excited for you to get to meet her. And I just want to say thank you. I will not be gone. I'll always be here. I'm always available, and I will still be involved with some things regarding the community, but really want to take the time to say thank you. And I want to introduce to you Esther Diaz. Let's see, I know Esther was trying to log on earlier. Esther, do we have you there?
Yes, Alicia, I'm here.
Hi, Esther. So Esther, if you could, I just want to hand it over to you for a few moments. You can just give a little bit of background about yourself and introduce yourself.
Yeah, thank you, Alicia. Yes, I've been with the county for about 25 years, and about 2000, so 22 years, I started at Martin Luther King Medical Center, and I had the opportunity to work on numerous important projects there for the community. One of them being the reopening of the hospital. This project started in 2008, 2009, and we managed to complete it in about 5 years. So that was a great success. We also constructed a new outpatient facility for them. And as of most recent, we completed the Behavioral Health Center. And it's the first of its kind in LA County, where it combines all of the services that are needed for the community. And it's a partnership between health services, mental health, public health, WEDEX, and probation. So that was a big success. And we were able to reuse the former hospital, that's 500,000 square feet. So I've also had the opportunity to work on projects at Harbor. I've worked on LAC USC. We finished, completed one of the outpatient clinics about 5 years ago in the outpatient building. So I'm really excited to be here. I know Alicia has done a lot of great work, and I look forward to working with you all and continuing the great work that you all are doing.
Great. Thank you so much, Esther. And I just want to finish out by saying there's a few questions in the chat. One of the ones that came up that I want to address, Heather, is will there be tours for the HICP group or HICP group before we do that grand opening? I think that's a fantastic idea. So I will get in the works with that right away, Heather, so we can get something together. So stay tuned. We'll have information. Thank you for asking that question. I think it's a fantastic idea. To everyone, thank you again. Thank you for all your kind words in the chat. Like I said, I'll still be around. I'll still be in touch with Rosa and Heather. And thank you so much. Everybody has been fantastic.
Yes, absolutely. And then I think Rosa wanted to say a few words as well.
Yes, is my audio coming in okay?
You sound great, Rosa.
Excellent. Alicia, just wanted to thank you for your incredible leadership, for your strength, for your many, many hours of dedicated time to ensuring that our community process went smoothly, that we understood from a community perspective the importance of staying on time and on budget with a lot of the community engagement feedback that was given. And, you know, we just want to acknowledge you because we know that there is a commitment by the county and by the supervisor's office and by the departments, but I think beyond that, it's the people. And just want to let you know that you are, you know, just such an example of leadership that goes up and beyond to ensure that we have the time needed, the understanding needed to bring our community along as partners. And at the last meeting, you know, we reflected on how important equity is and the equity table that Health Innovation Community Partnership offers. And I feel like a lot of the reason that worked was because of leaders like you. And so, you know, just want to let you know that we are so appreciative of you. We wish you the very best on your next project, but you are always, you know, part of HICP, and please, you know, stay connected with us. And thank you for already a lot of requests that have come your way as you've been telling us you're leaving, you know, to ensure that the transition is smooth. We do want to welcome you, Esther. You know, we know every person is unique, and we look forward to your strength and, you know, your leadership in continuing these projects to fruition. And just thanking you both and your department and your department leadership for, you know, just being an extraordinary part of why, you know, HICP has worked as long as it has, and why we have a very demonstrative list of what is working when community and county work together at one table, you know, step by step. So thank you guys so very much for, again, everything that you have offered. And we look forward to continuing our relationship with each of you in your different roles and with the department. And then finally, just want to acknowledge that, you know, for us, the county partners and your reflections on what's working and what isn't are so essential to the success of community engagement efforts. And so just inviting, you know, other county partners to continue to inform this process and to help us, you know, always strive for better and better platforms. I think for our community, if I can, you know, just share a little bit of what I've heard from our partners in the community, it's a different environment when you have engagement and relationship versus, you know, one meeting or two meetings or a few meetings. So, you know, just reflecting that has made an extraordinary difference in how we all perceive the understanding of the relationship when we became involved in health innovation community partnership. So congratulations, Alicia, and
That means,
welcome, Esther, and thank you so much.
thank you, Rosa. That means so much. And I just want to say to Rosa's point, I mean, it's been a process, but I really want to leave you with the appreciation that all the effort that's come from this group, from HICP, that you took these processes with such sincerity. And it's a big responsibility, because when something new is tried, it's looked at as the definition of, does it work or not? And I think with all the effort that's come in here, without a doubt, we can look back and say, yes, it's worked. So thank you. You've really set the standard going forward, and that is really owed to the HICP community. Thank you so much.
Thank you again. And as we say, it's farewell, not goodbye, Alicia. And of course, welcome, Esther. We're so delighted to bring you forward to our table, and it'll be wonderful to learn from your experience at the other health campuses across our county. We're delighted, of course, to have such excellent leadership, continue in partnership with the Health Innovation Community Partnership, and of course, working on the wonderful projects that are just at the cusp of continuing development here on our campus. So next up, we are very delighted to welcome a presentation by our own Dr. Janina Morrison and Ismael Castro to talk a little bit about COVID in our community and what the implications are right now, where we are in the pandemic, and kind of some of the local flavor to the COVID numbers. So Janina, are you ready to go?
Good morning. Thank you. So my name is Janina Morrison. I am a physician working for LA County Department of Public Health. And my real job is at the Wellness Center. I am the medical director, and I've been there since about 6 months after it opened. But recently, most of us at the health department have been spending our time working on the COVID pandemic. So right now I have a COVID assignment. And so I wanted to come and show you sort of the state of what's going on with COVID right now, and then show you some of specifically what we know about the surrounding area at LAUSC. Oh, I can't change the slides. Okay, so let's just start with some general data. So I have a bunch of pretty pictures from the county. So I'm going to go a little bit fast, but you will get these later in the recording, or maybe Heather can share the PDF as well if you want to take some time and look at them closely. So this is some data from last week that shows the overall case numbers. That's the green line. And then the orange line is the number of people in the hospital. And this follows closely with what Jorge was telling us. You can see over on the right side of the screen that those are the case numbers we've seen with the Omicron surge, which started in December, early December. So the good news is you can see there's a peak there and the numbers are coming down. The bad news is that it was a very high peak. So the numbers went up all the way to close to 40,000 cases a day. So our numbers are coming down, which is great, but the numbers are still higher than they were at any time, even last winter, when we had our really scary winter surge early in 2021. So we still need to be careful. We're still recommending caution. The orange line, you can see that's the number of people in the hospital. That also is starting to come down. And then the blue line, which is very hard to see at this point, is the number of people who are passing away from COVID. And that it has gone up. And unfortunately, we are seeing more deaths from Omicron. It's almost all people who are unvaccinated, which is really heartbreaking. And we do expect that number to stay up for a little while. So next slide. So then I just want to sort of take a closer look. We're very concerned about health equity at the public health department. And so we've seen that there are big differences between communities in this particular breakdown is by race, ethnicity. So way over on the right, you can see the lines that we're just starting to look at for the Omicron surge. If you look at last winter, you can see the yellow line is cases among our Latino community, and you can see it was way higher. So we had much, much more people testing positive. And this is not just because we have a lot of Latino people in Los Angeles. This is per population. So the percentage of people was really, really high. And then it was slightly higher among Black African Americans last year. What we're seeing this year is again that it's higher among Latinx, and it's also quite high among Black African Americans. And that some of that is because these communities are our essential workers and are in these high-risk settings working. But a lot of that is because the vaccination rates are quite low in these communities. Next slide. So then the last slide like this I wanted to show is death data. So we're still following closely to see about people who pass away from the Omicron variant because it's still a little bit early, but this goes back to the summer when we started to see the Delta variant, and you can see a little bit in January. And this is just a comparison of the number of people dying by age and vaccination status. So you can see those highest numbers is the green dotted line. And that's been, it went up in the fall when we had the Delta variant, and then it's going up really high. That is unvaccinated individuals over the age of 65. And you can barely even see the line for vaccinated individuals over the age of 65 because the vaccine is so good at protecting from severe COVID. So, and then you can also see separate from the bottom, the dotted yellow line, that is unvaccinated individuals between 50 and 64. So between 50, being 51, we don't think of that as being very much older and high risk. But for people in that age group who are unvaccinated, we are seeing increased death from COVID. So, so this is just important. These are populations we're really worried about. Anyone over the age of 50 who still is unvaccinated is still much higher risk for getting really sick from COVID and even dying. Next slide. So here is some of our vaccination rate numbers, and I'll look at these in a second, broken down by race, ethnicity. But so one of the areas we're focusing on right now, you can see for LAC residents 65 plus, that's the first row, we have 90% fully vaccinated, which is fantastic. So I'm still really worried about that 10% because they're very high risk, but 90% are fully vaccinated. Unfortunately for the Omicron variant, that's actually not enough. And we see that we really need that booster dose to protect people from getting really sick. The Omicron variant is super sneaky, and we just don't get enough protection from 2 shots, but the booster gives us really good protection. So we still have only 59% of residents 65 and older who've gotten a booster. And you can see if you follow that, if you look below the 59%, in the other age groups, it's even lower. Overall, only 31% of LA has gotten their booster. It's about 50% of the people who are eligible. So half the people who need their booster still didn't get it. And then the only other number on here that I want to highlight is in the second row, percent LAC residents 5 to 11. We only have 31% who've gotten a dose in the younger kids. And that's just nowhere close enough to what we need to make sure that schools continue to be safe and that kids don't have disrupted learning. Next slide. So here is this is the number of vaccines we're giving per week, going all the way back to when the vaccine came out in December 2020. So you can see in March of April, we saw this huge bump up. This is when, everyone was scrambling to get an appointment, lining up. And then things really dipped down during the summer. And we have seen, since the boosters became available and they were recommended for everyone, we saw the numbers go up in October. But what makes us nervous right now is in the last 3 weeks, the numbers are already going down. So we still see that there's lots of people who need to get boosted. There's lots of kids who need to get their first shot. And people are already backing off and saying, oh, Omicron is gone. We got through it. A lot of people already had COVID and they're saying, I just had it. I don't need the vaccine. And that's not true. We don't know how long that natural immunity lasts. So we are still strongly recommending, even for people who just had COVID, we know it's safe, and you should get your booster right away. And for kids, we need them to get vaccinated. Next slide. And then here's the breakdown by race, ethnicity, and there are big differences. So looking over on the far right, under entire racial ethnic group, you can see, among Asian people, we see 87% vaccinated. It's as low as 58% for Black African American Angelenos. And then if you go all the way to the other side, under 5 to 11, all of the numbers are pretty low, but the numbers for Black and African American and Latinx children are really low. So only 17% of kids in those racial ethnic groups are vaccinated. Next slide. So now I want to show you some maps. So these show the case rates. So this is the amount of COVID we've seen in different communities. This is all of Los Angeles. The darker it is, the more COVID we have. So you can see, if you go to the next slide, Heather, it shows us where we are. So I zoomed in a little bit, and then I highlighted Boyle Heights. So you can see, if you look over closer to the beach, it's lighter, they've had less COVID. And then as you get to our area and down through sort of southeastern LA, it's all a darker blue. That really dark spot, I don't want to spend too much time talking on it. That's actually the city of Vernon. And there's just a lot of cases there because a lot of people work there. It's not actually a lot of people who live there. But you'll see Vernon is always a different color. But you can see there's a really big difference. You compare us to West LA, and we have had a lot more COVID. In Boyle Heights alone, which is not a big neighborhood, more than 35,000 cases since the beginning of the pandemic. Next slide. This is deaths, so number of deaths. And you can see a similar pattern. So you look over by the beach, it's lighter, not very many deaths. In Boyle Heights, it's a medium blue color and almost 500 deaths in our community alone. And very similar among our surrounding communities. So then more maps, different color scheme. This is the amount vaccinated. So in these ones, the darker it is, the better it is. So the only yellow you can see is Catalina. I don't know what's going on over there, but nobody's getting vaccinated. And then the purple areas are the most vaccinated. So I think the next slide, Heather, is close. Oh, no, sorry, go back. I tried to close up and the website wouldn't let me do it. So it's going to switch into a graph form, but you can see if you try to imagine where we were looking before in Boyle Heights, there are some areas around us that are closer to the dark purple, which is great. And we are in the blue zone over in Boyle Heights. Okay, next slide. So this is specific Boyle Heights rates. So the dark blue is LA County, and then the lighter is specific to Boyle Heights. You can see we're slightly below the LA County average. And there was a big jump up in the spring, like we saw through all of LA County. And then recently it's just been going up really, really slow. And if it continues at the rate that it is now, we will likely get close to 80%, which is good. But if it doesn't change specifically for those the younger age groups, we still may see a lot of disruptions of daily life. Next slide. And then here, these are the actual percentages by age group. So I compared, I could only do it alphabetically, so it's a little random what we're comparing to, but I thought this was interesting. So like comparing Brentwood to Boyle Heights in total population vaccinated older than 5. So Brentwood is up at 86.4%, and Boyle Heights, though close to 80, is significantly lower. It's actually lower than Brentwood, Beverlywood, and Beverly Crest. I see a question. I'll get to that in a second. And then I just want to highlight the specifically the 5 to 11. You can see those numbers are way lower. So in Boyle Heights, only 20% of kids 5 to 11 are vaccinated, whereas in Brookside, I should have looked this up. I don't know where that is. But Brookside is 97%. So we're seeing huge differences by community. Next slide. Okay, so what are we doing at the health department? So right now, a lot of focus on community-based efforts to promote vaccinations, and in particular, the boosters and the vaccination of kids 5 to 11. And this is basically, my theory is people are just done hearing from the health department. A lot of people don't want to hear from doctors anymore. And so we are trying to think creatively about how to find community champions, people in the communities who are willing to talk about the vaccine with their friends, their neighbors, their school communities, and make sure that they have the right information to answer questions about the vaccines. So we have a lot of community health workers out there, some directly funded by the health department, some through community-based organizations. The Wellness Center is one of those, has a big team of community health workers who are doing amazing work. They're on campus at LAC USC, and then they're out in the community at churches, going to businesses, organizing vaccine events. We have parent and student ambassador programs. So you can do a training to learn about the vaccine, and then you get a certificate as a parent ambassador and can speak to your school community. The health department schools team is also giving small grants to community-based organizations to work with schools. So schools will have vaccine events, and then the CBOs work on getting the word out, getting people in the door, answering questions. I'm now doing a weekly conversation, one in Spanish and one in English for all these groups, where people can come, and if they've had questions while they're out in the community, they bring them and we discuss them. And then the last thing, which is less community-based, is for the kids, we really need pediatricians to start offering the vaccine. There's a lot of pediatricians who haven't gone through the process of becoming a vaccine provider. And a lot of parents just, they want to get this vaccine at the pediatrician. They don't want to get it anywhere else. And we are looking forward to the vaccine coming out for younger kids, probably soon, maybe by the end of the month or early March. And, you know, parents with little kids, they really don't want to go to a grocery store to get this vaccine. They want to go to the doctor's office. So this is something we need community help with too. We kind of need to put pressure on these pediatricians and say, you know, it is a little bit of work to enroll to become a vaccine provider, but we don't think COVID is going anywhere. We need these doctors to sign up and start offering the vaccine. Okay, I think that's my last slide. Okay. Let's see. Let me look at the chat.
Yeah, we have a few questions for you in the chat, Janina. The first is, what is the reason booster rates are lower for Latino and Black adults and kids?
Um, I don't know the complete answer to that question. That's one of the reasons we're doing all this community outreach. It's not an access issue. In the same way that it was in the beginning, where they're not available. The boosters are very available. They're free. You can get them at multiple different sites. I have a feeling there's just a lot of concern in these communities. From what I've heard, people are asking, like, wait a second, you said it was going to be 2 shots. Now you're saying it's a 3rd shot. The rollout of the booster was pretty confusing. At first, it was only for these people and then only for those people. And I think people just got confused, and they're worried that it's not really necessary. They know a lot of people who just got COVID, and so, or they themselves have just got COVID. So we're really trying to get out there and make the case. We know the boosters are safe, and they really make a big difference with the Omicron variant, which makes us think for the next variant, you want to get that booster before the next variant even shows up. We don't know when the next variant's going to show up. We're trying, and the thing that I'm optimistic about is that people who need a booster, they already got the first 2 shots, or some of them got 1 shot. So for people who haven't gotten any shots, I'm not sure we can change their mind. There are people really, they're really set in their ways. But for people who got the first shots, I think we can change minds about the booster if people have questions. And so I really want us to talk to everybody who hasn't gotten the booster, see what their questions are, and try to get them boosted soon.
So that's an excellent dovetail into Ari's second question, which relates to, if we know who's been vaccinated, could we follow up with a text, a reminder to get the booster?
Yeah, the health department, the Los Angeles Health Department, doesn't control all the data on who's been vaccinated. It's the state. So it's one of these silly things where, like, California is the one who tracks everyone who's been vaccinated, because LA County Department of Public Health didn't do all the vaccinating. A lot of it happened at pharmacies. And so we are asking, like, doctors, reach out to all your patients and tell them to get the booster. But it's a little complicated with, like, who has the data and who can send out those texts. That's a good idea, though. I can look into that and see, maybe, why isn't the state doing that? I don't know. I can ask them.
It's a good idea. It's a very good strategy. That's what, when we have people with, like, Ari with the marketing skills behind her, right?
Yeah.
Let's bring that together. And then another question is there a reason that vaccines are not happening at COVID testing sites? Vaccination is not happening at COVID testing sites.
Yes, so they're certainly not happening at all COVID testing sites, but they are happening at some. And people ask me the flip of that question too, because now there's been a lot of interest in testing. So they're saying, well, you have this vaccination site, why aren't you offering testing? And so we're whenever possible, we're trying to combine those. It's just they're licensed by 2 different parts of the government. And so, you may be all signed up to be a tester, but you never went through the process to vaccine. And actually giving the vaccine is much more complicated than just doing a test. You have to have, you have to really make sure you have people who know about all the different parts of, like, safe administering. And now we have a bunch of different kinds of vaccines. So we don't just want everyone to say, we're going to offer the vaccine until they've been, like, fully vetted that they can do it safely.
Great. One final question. I'm curious about county efforts to outreach to young Latino and Black men.
Yeah. So actually, it's been great. The community sessions that I'm doing I have seen more young Black and Latino men at these sessions that I have ever seen at any health-related session. And I think that's due, what we're doing is we're picking the most high-risk communities, and then we're going to community organizations that are already well established, and particularly pairing up with groups that we know can reach communities that are hard to reach, which includes, like, in general, men are not known for coming into healthcare very frequently. So we're working on that, and I've actually seen success.
Great. Thank you so much, Janina. Wonderful presentation. Really nice to see all of that specific data. And of course, you always express things so calmly and simply so we can all absorb the information. Much
Thank you.
appreciated.
Thanks
We
for
also
having
invite,
me.
you're welcome anytime. We also have a few comments from our colleague Ismail Castro, who is working as part of our outreach initiative related to the COVID vaccine. He's going to reflect a little bit on kind of community considerations and how the conversation is going in terms of promoting the vaccine and booster. Ismail.
Thank you, Heather. Thank you, Dr. Janina. Hi, everyone. Ismail Castro with the Wellness Center, and I've been involved with the Community Health Worker Outreach Initiative since November of 2020. And so I'm here to hopefully spread some hope and talk about the great work that our team is doing. And yeah, similar to what Janina shared, like some of the concerns have shifted, and it's not necessarily about access, right? But there's continued distrust. And so it's so important for our community to be out there addressing the hesitancy that comes up with each variant, right? And so before, with Omicron, we started hearing from people, well, you know, I got COVID, I didn't get so sick, maybe I don't need the booster, maybe I don't need a vaccine. And so our team has weekly calls with Dr. Janina Morrison and other health professionals to make sure that they're truly equipped to answer the questions in our community. And we make sure that we visit everywhere people live, learn, play, eat, and pray. And so some of our most special partnerships or most successful partnerships have been with churches in our community, Resurrection Church, St. Isabel, to name a few. We've also made sure that we update all of our information on the Wellness Center's Instagram. And so our team members are constantly updating information. And like we saw in one of Janina's slides, COVID is constantly changing, and the information that was new last week maybe is no longer relevant this week. And so our team is constantly updating the information, and we make sure that staff is available on our 213-784-9191 line from 8:30 to 5 p.m. to answer questions, navigate people to resources in need. And just to conclude, we also have to understand, you know, we can reach all community. And so we've partnered with Maternal and Child Health Access to reach families and women. We've partnered with Legacy LA to reach students and parents, and Latino Equality Alliance to reach LGBTQ community individuals, including students as well. And so I think these partnerships working together is hopefully gonna address some of the low numbers that Janina shared, and just super grateful to be part of this work. Thank you.
Thank you, Ismail. Thank you, Dr. Janina. I think we've answered the questions that came through the chat, so we'll move on. In the interest of time, we're going to move on to our next presentation. I'm delighted to ask Pam and Greg of the HICP co-design to join us with a presentation and update on tenant protections.
I'm on mute. Thank you, Heather. Can folks hear me okay? Okay.
We hear you fine.
Great. Good morning, Health Innovation Community Partnership. My name is Pamela Agustin. I am a coalition organizer with the Eastside Leads Coalition, and Public Council is a member of our coalition, and together we are part of the LA County Stay Housed LA County program. I'm just going to pass it to Greg to introduce himself, and then we'll start this presentation.
Thanks, Pamela. Hi, everyone. Good morning. Greg Bonet, a staff attorney with Public Council. Worked closely with Eastside Leads for many years and been part of the HICP for many years. So thanks, everyone, for the time on the agenda today to talk about important updates regarding tenant protections.
Yeah, and just Greg and I have been consistently coming to this body to just keep you all appraised of the changes that our county is doing, what they're doing, right, in terms of expanding tenant protections for residents. But for those of you that may not know, Stay Housed LA County is a resource that began in 2020. It brings together community-based organizations, nonprofits, legal service providers, and also LA County Department of Consumer and Business Affairs, LA, its branch in the city, and Liberty Hill. And together we bring this resource to educate and inform residents about their rights, but also connect them to free legal services should they be facing eviction. Next slide. So Greg and I, we're going to be covering, the most recent changes to the LA County tenant protections because there was a vote last month, late in January, 4-1 vote, and these protections have been extended, but with some modifications throughout the year. So we're going to be reviewing that today. And then we're just going to review how can Stay Housed LA help you, depending on, common questions that we hear during our clinics. Now, our presentation is bilingual. For residents that are monolingual Spanish speaker, you will be able to read the information. However, if you are facing a situation, and we understand that things can change very quickly, and you want to talk about it, or you have a question that maybe you're not as comfortable dropping it in our HICP chat, feel free to text this number, and you don't need to give us a lot of detail, but at least it'll allow us to get back to you, maybe during the session, during Q&A, maybe post the session. Next slide. And so now we're going to review the LA County protections. Next slide. So first of all, since March of 2020, really, the county, our Board of Supervisors have been very proactive in passing laws to keep families housed during this pandemic. At some point during this transition that we've all been of a pandemic reality, right, the county protections did extend to all 88 incorporated cities and unincorporated areas of the county. And historically, they've applied to residential tenants, commercial tenants, and mobile home space renters. And they will continue to apply to residential tenants, commercial tenants, and mobile home space renters. But like I said, with some modifications this year, and Greg is going to tell us a little bit more about those modifications pretty soon. Next slide. Again, how long will these protections last? And this is one reason why Greg and I, and also Department of Consumer and Business Affairs, have brought these updates to this body of HICP. It's because they have been consistently changing, right? These protections, what they last, what they cover. We've all been in this pandemic reality for 2 years. But now these protections will extend to the end of this year, 2022, December 31st, 2022. And I just want to pause here and acknowledge that our Supervisor Hilda Solis and her team, we thank you, for hearing tenants' stories and really pushing for some of the, for making this protection possible, extension possible. But also thank you to all of you in HICP who turned out public comment and voiced why these protections should be extended. So really a testament to how in this body we're able to work, right, and advocate. So heart to all of you. Next slide. So again, the protections were extended December 31st, 2022. They will be implemented in 2 phases, and we are right now currently in the first phase until May, end of May of this year. And just sit tight because Greg is about to review it for you. Next slide. Okay, so the Department of Consumer and Business Affairs came up with this great chart. As you can see, it's pretty easy. I just want to review what the process is, but then I'm going to pass it to Greg, who's going to dive deeper into it. In this chart, you're going to be able to see in blue, phase 1. This is the phase that we're currently in, February 1st to May 31st, 2022. And to your right, the second phase of tenant protections that we're going to engage in later on this year, which will begin June 1st. And as you can see, will end December 31st, 2022. To the left column, you from home will be able to read, what's staying the same. In yellow, what's being added during these 2 periods. In dark brown, what's going away. And if anything you take away from our presentation from Greg and I today, just know I'm about to attach a link to this chart in the chat. You'll be able to have it from home, but Greg's going to dive deep into these two phases. Greg, I pass it to you.
Thanks, Pamela. Right. So we're gonna get into the details here, but I did want folks to know that this chart was out here. It does a good job of summarizing many of the protections and many of the changes, on a single piece of paper. So I think Pamela's could put the link to the chat, and you can always just go to DCBA's website, and they have it there. But we'll start going through it. Pamela, are you controlling the slideshow or ready for that, or is that Heather? Okay, Heather, next slide.
Heather.
Okay. Thank you. All right. So like Pamela said, the county extended its emergency protections until the end of 2022. This was a really big deal. This was a motion by Supervisors Kuehl and Solis, and it really represented a change in how the county has addressed tenant protections during the pandemic. It is sort of acknowledging that this pandemic is not resolving as quickly as we all hoped. And I think like Dr. Morrison said earlier, we don't know when the next variant is going to emerge. And it's important that we do a little bit more long-term planning, and we have some protections in place so that when there is a new variant, when there are disruptions to employment and childcare, and folks are getting sick and folks have to isolate, we have protections on the books already that people know about, that they can rely on, so that they can stay home, they can address their childcare needs and not need to worry about being evicted. So I think this was very forward-thinking of the supervisors to have this longer time frame. It is also a slow phase out, which as tenant advocates, I always makes me nervous. I say I want to see the strongest protections for as long as possible. But I think this is a bit of a compromise to acknowledge, okay, we need some protections in place for a longer time frame, but we're also going to start slowly phasing them out. So I'll talk a little bit about what that looks like. So if we stay here, yeah. So some of the core protections in the county order are protections from eviction for things like alleged nuisance, having additional occupants or pets that's related to COVID. So many households have had to sort of shuffle. Family members move in to help with childcare. Family members move in because someone is not getting the same amount of hours, maybe can't pay the rent. They need to consolidate households. New roommates come in to help make rent. A lot of times family members will bring their pets with them. So these are all extremely common scenarios. People were doing what they needed to do to adjust to the pandemic. And that left a lot of people moving into an apartment or living in an apartment where they weren't on the lease. So the county's emergency protections acknowledge that and say, hey, if you have additional occupants or you have additional pets that are there because of COVID, that's not grounds for eviction. So that protection will continue through the end of the year. There's also a scenario that we unfortunately heard about very frequently, especially early in the pandemic, were these conflicts where a household is trying to isolate, particularly when there are potentially children or immunocompromised people or folks that aren't vaccinated. They are trying to isolate, but the landlord insists on coming into the unit. Oftentimes it seems like it wasn't necessary for the landlord to come in, and people had nowhere to go. They're like the only safe place for them to be was in their apartment, and then the landlord would come in. So to address this, the county put protections in place to say if you deny entry to your landlord, that's not going to be grounds for eviction. Now there are some exceptions for that if it's an emergency. And that protection is largely phased out starting in June, but at least for the next few months, that protection is still there. There's also the order prohibits no fault evictions. So generally speaking, if the tenant did not do anything wrong, they shouldn't be evicted. There's a small exception to that I'll talk about in a second, but through 2022, no fault evictions are prohibited. And rent increases on RSO units in unincorporated county, rent increases are generally prohibited. So if you're in a rent stabilized unit in an unincorporated area, rent increases are prohibited. And the city of LA has a similar policy for rent stabilized units in the city of LA. There's also some enhanced protections and penalties for to try to deter landlord tenant harassment. So if you're a tenant and you feel your landlord is harassing you, definitely reach out to the Stay Housed LA resource. There are extra laws on the books and extra penalties that hopefully could help get that resolved. And an important caveat here, I said earlier that generally no fault evictions are prohibited. That's true, though. As part of this phase out, the county is going to allow a greater number of what are called owner move-in evictions. So if the landlord owns the unit and the landlord says, I want to move in, I'm going to live there, or my immediate family members are going to live there, those evictions will be allowed and increasingly allowed after June 1st. But I do want to just say that there are still quite a few restrictions in place and quite a few safeguards. So we have seen far more landlords claiming that they're going to evict based on owner move-in than actually meeting the requirements of to do an owner move-in. So if you're a tenant and your landlord says that they're going to evict you because they're going to live there, definitely reach out to Stay Housed LA or to a tenant attorney, because there are a lot of rules there and there are a lot of safeguards. And honestly, more often than not, when we've seen landlords do that, they actually don't meet the requirements. It's a little complicated. More owner move-ins will be allowed, but there are a lot of restrictions and safeguards in place. So it's important to talk to an attorney or connect with Stay Housed LA. And then lastly here, so these protections, this is really important. Normally, the county's tenant protections apply to the unincorporated areas, which is home to hundreds of thousands of tenants. But during this emergency, because the COVID emergency has impacted the entire county, and this is a public health emergency that crosses boundaries, the county has used its emergency powers to apply these tenant protections countywide, including within cities. So even if you're not in an unincorporated area, if you live in Alhambra or Compton or Inglewood, an incorporated city in the county of LA, these protections apply to you. Heather, you can go next slide.
Thank you, Greg. And just if you can go to the back slide really quickly. Heather, thank you. Just pausing, Heather, to remind our Spanish-speaking. I was in the wrong channel. Spanish-speaking residents that we do have slides in Spanish. Greg, back to you.
Thanks. Just a note that the county's eviction protections for commercial tenants for small businesses, those did expire at the end of January, though there are still some protections in place for what's called enforcing a personal guarantee, where a landlord might go after the business owner's personal assets. And there are still some anti-harassment protections in place. I'm not going to get into a lot of detail on the commercial protections here. Just to note that there are still some commercial protections while others are expiring. And just an important clarification on the county's application to incorporate cities. The county's order does apply countywide, but it doesn't prevent cities from adopting stronger protections for the city residents. So the county has sort of set up a countywide floor, and then cities can go above that and have even stronger protections. Sorry, I wasn't quite clear on that earlier. Okay, we can go to the next slide. All right, so starting on, I talked about nuisance and unauthorized occupants and no fault evictions, but a lot of folks are saying, wait a minute, I can't pay the rent. That's my problem. So the county is going to include protections for folks that can't pay the rent due to COVID. This has been a complicated issue because the state has also adopted protections, and up through the end of March, up through March 31st, the state protections really control, unless you're in a city that has had protections in place since before August 2020. But for the most part, the state protections control through the end of March. Starting on April 1st, the county is again free to regulate this and has chosen to do so. So starting on April 1st, if you live in the county and you can't pay rent because you've been impacted by COVID, the county protections provide you a defense. It's important that you tell your landlord within 7 days of rent being due that you can't pay and it's because of COVID. If you go to the next slide. This restriction, as part of the sort of phase out scheme, this protection becomes limited on June 1st to low income tenants, tenants that are at the 80% AMI or below. But for those folks, it does continue through the end of the year. So starting June 1st, sort of the same situation. If you're a low income, 80% AMI or below, if you can't pay because of COVID, tell your landlord within 7 days. You can self-certify that the impact that you can't pay because of COVID, you can self-certify that you meet the low income guidelines, and that will give you a defense from eviction for non-payment. And then you'll have 12 months to repay that rent from the end of the protections, which right now are set to expire December 31st, 2022. So that would be, you would have till the end of 2023 to repay. And after that point, the landlord could sue in small claims court, but it should not be evictable debt. And then like we mentioned earlier, the other protections continue through 2022. The owner move-ins there's less restrictions on owner move-in after June 1, but still a lot of safeguards in place. So definitely talk to an attorney if you get a notice there. And then the protections for denying entry to landlords are also weaker after June 1st, 2022. But those non-payment protections for low-income tenants extend through the end of the year.
And next slide.
And I'm just seeing in the chat here, Ari, I think you're asking, is there a special document you need to sign to self-certify or to provide that 7-day notice? A lot of, I think, a lot of different like legal services orgs have some example documents you can use. There is no magic document you need to use though, as long as you can tell your landlord, and preferably in writing, I can't pay rent. I've been impacted by COVID. Starting in June, I meet the income eligibility. There's no magic document you need to use for the county's protections. And then Pamela, I think I'm handing it back to you on the rental assistance. Is that right?
Yes, thank you, Greg. So everyone, Greg just went more in detail into that chart that you all now have in the chat. For the purpose of time, I know there's a lot of questions in the chat. Greg and I can go into the chat and respond, because I know that there are other presenters that are joining the HICP today. Just know that Public Council, Eastside Leads, and our coalition partners, we will also work with Self-Help Graphics in this work to get this information out. We can support you. But very important, if you are a tenant that owes rent and is being told you have to leave because you owe me rent, you should apply for rental assistance immediately. Eastside Leads can support you, but there are other organizations that are also supporting with ERAP. The Wellness Center also gives us information about the emergency rental assistance program. So again, please apply. Just know that if your landlord tries to evict you for not paying the rent, they have to prove that they themselves, landlord, applied to ERAP and informed you also of the need to apply. So with that, we're going to end our presentation here, but just know you can go to stayhousedla.org to get into a workshop similar to what Greg and I just covered. And we'll take questions in the chat. Back to you, Heather.
Yeah, thanks so much, Greg and Pam. Always a wealth of information and expertise and just incredible advocacy for our community. I apologize we didn't have sufficient time to go through all the slides, but as always, we will be emailing the slide deck around to everyone at the meeting, and it will be posted on the HICPLA website, so you can read the slides in greater depth there. With that, I'm delighted to pivot to our next presentation on the General Hospital and West Campus Feasibility Study. I'll turn it over to my colleague, Alex Villalobos, to give us some highlights, and then we'll be asking Doug Cohen from WEDAX to speak with us about the RFP process. Alex.
Hi, good morning, everyone. Thank you for this opportunity. I'm so glad to be back in the presenter role here with the HICP this morning. I'm excited to speak here today as a member of the Community Engagement Study team for the General Hospital and West Campus Feasibility Study to bring you the HICP, our relaunch of this exciting opportunity with this amazing county asset. So we have begun the process of reigniting our efforts in community engagement as the technical team progresses through their work. So if you recall, we have, COVID had slowed some things down, but we're excited for the whole team to get back, to work and hope that you can help us in your participation here with the HICP, as well as your individual groups, in spreading the word about this exciting opportunity, help us in gathering this valuable information so that we can best serve our community, and make sure that we work as a team in making this project become a reality. So I wanted to provide you all with this timeline so you can see where we've been, where the asset itself has been, and where we're going. So I don't want to get too much into the small details, but you might be familiar. This is a 1.4 million square foot building. It's a very impressive structure that was built in 1933. In 1994, the General Hospital damaged by the Northridge earthquake, accelerating funding for a new medical center. So because of the damage, there was too much to be salvaged about the asset itself to make it reusable and a feasible opportunity. In 2008, the General Hospital closed to clinical services. So it was actually in very recent history that there was still in a certain amount of function. In 2013 to 14, there was a $10 million investment in the first floor to build out to the wellness center. And we're all very familiar with what a absolute asset that the wellness center is to the community. And we hope to encourage its growth. In 2018, there was a board motion for the feasibility study, this process to begin, as which we've progressed. And of course, the community engagement and technical analysis began in 2019. And unfortunately, we get to 2020 where our efforts, we were making substantial progress in the community, and it was great. It was so much fun for all of us. And it got slowed down by our good friend, Mr. COVID-19, which put a damper on things. But again, moving on, because we are moving beyond that gladly. So in 2021, where we are at now, we will recommence our community engagement, which we begin with you today. So thank you so much for this opportunity to do so. And in 2022, we will conclude the study, report to the Board of Supervisors, issue an RFP for developer selection of what will become of this invaluable asset. So it's a really exciting opportunity. There's some changes. We have the opportunity now to take advantage of funding sources and other opportunities to make this thing a reality. And it's a very dire time, as all of you are well aware. I mean, just the presentation that we heard, just the previous presentation, that is, we understand that the most vulnerable in our community need our assistance, and we need to come up with, well, these valuable solutions as soon as they're able. So with that, I thank you again. Thank you so much for this opportunity. And I'd like to turn it over to our colleague, Doug Cohen, to give us an update on our request for proposal process and what it would take to move this project from the feasibility study and community engagement process into more of a reality. So thank you. Doug.
Alex, thank you for the handoff and the introduction. Can everybody hear me?
Yes, we can. Thank you.
Okay, fantastic. And I apologize. I'm speaking to you from a parking lot right now. We're doing a little multitasking, but it's the focus on this project is essentially project delivery. So when we talk about the RFP, I'm going to give a little bit of background, and I hope not to be repetitive from some prior meetings. But I think it's important to understand what the RFP is. So many times in government, we surround ourselves with all of our colleagues, and we're all very familiar with the alphabet soup in which we speak. But to the larger group here, the RFP is a request for proposal, and it's essentially it's the process by which we advertise and notify a developer community and the industry, the developer industry, that there is a project that we want solicitations on. We will be evaluating the solicitations in a set forth of parameters, and that's the formatting of the RFP. And then there is, at the end of this evaluation process, that's when a selection is made to engage in a series of negotiations that ends up in a contract for development services. And that is standard. That is a standard description of an RFP process. An RFP process for a large project such as this comes in different formats, and they all have their benefits and approaches. But essentially, one of the key components that we're interested in is the project delivery timeline. A lot of what we've heard so far in this discussion about health services and the capacity to deliver health services to this community has to do with the capacity to meet current needs, current surge needs. And we are attempting to leverage these assets in a way where we unlock the value of these public assets to the greatest extent possible, and yet do it in a way where we can deliver this very substantial, very large, very complex project in a timeline that, quite frankly, would be shorter than otherwise expected. That is the actual focus of our job with the RFP, is to do something where we're protecting the county and the public's interest, but we're doing it in a way that is not the necessary typical routine where we might end up looking at 5 years or 6 years or 7 years or 8 years of just negotiations with the selected developer. We would like to look at ways in the next 60 to 90 days of ways that we can really legitimately expedite that negotiation process. So once we select the developer, we want to get to the point, what I refer to as sticks and bricks, where we're actually rolling the materials and the labor that builds the buildings to that site as quickly as possible. This is a 25-acre site. It's the rough order of magnitude on this site is still being studied, but it is going to be substantial. It is going to be probably one, if not the largest projects in the county. On a statewide basis, it's going to be one of the larger projects in the state. And when that ROM cost is started to, the assessment is done and delivered, I think we're going to all be seeing that we've got a very, very significant scale before us. Nonetheless, we want to get this project under contract and under construction as quickly as possible. And so the timeline for the RFP, we've heard a lot about the feasibility study, and the feasibility study is a substantial document. It involves not only the constructability scenarios, but also the community outreach component that's been vital to so many of these meetings. All of that work is going to be the basis of what the RFP then outlines in its request for proposals. So the developers that propose to be selected, evaluated and selected for this contract are going to be they're going to be adhering to the prioritized elements that are in this feasibility study. And so I know you've had many presentations from the CEO's group on the feasibility study. Their work is coming to fruition over the course of the next 3 to 4 months. I believe it's at the end of April, we're expecting something. And that's going to be a substantial body of work that will be the basis of the RFP document. And it's going to be the formation of how these developer proposals get assessed. So at the end of the day, what we're looking to do is have a document that provides a parameter for the developer community upon which they would be assessed on not only board initiatives that are to be prioritized, an illustrative scenario for the delivery of an aggressive housing component, certainly the capacity to revitalize the general hospital structure itself, but also to do that in a way that minimizes the reliance on public subsidies, maximizes the reliance on private equity and private funding sources, and quite frankly, maximizes the efficiencies with respect to the timeline for the delivery of the project. And so that's essentially what we're looking to do. The RFP draft is going to occur. It's the reason I'm speaking right now is we're about to initiate this RFP process. The creation of the RFP documents should be, the board is going to be approving some funds here, hopefully on Tuesday. It's on the agenda. We expect that that approval will come forward, and we are ready to accept proposals that are in front of us to initiate this process. We hope to have a rough draft for the board to review at some point in the next 60 to 75 days once we initiate the contract. And so that would put us sometime in the beginning of April, the feasibility study coming at the end of April. We would then go out to the developer community with some sort of industry days for additional input and fine tuning. We then hope to have the timeline where the RFP actually goes out to what we call the street, but essentially gets posted for the solicitation for developers to create their responses. And that would be in the late June, mid to late June of this year. The proposal period and the creation of those responses from the developer community that's interested is probably going to be over a 4-month period. And that would allow us to be looking at the selection of a developer by the fall of this year, 2022. And I think that aligns with some of the dates that Alex just provided you. At that point, once this whole RFP process has ran its course, then we get into what did we do during the RFP process to enhance and expedite the negotiation with the selected developer, the entitlement process for the scenario upon which the developer was selected, and how are we going to shorten that timeline so that we can get to that point of sticks and bricks as soon as possible. And so over the course of the next 60 to 75 days, we're going to start talking to an awful lot of subject matter expertise on this contract award process. And we hope to actually come up with something, quite frankly, that everyone has a great deal of comfort in, a great deal of confidence in. But I think it's also going to be a template that may very well rewrite the book a little bit on how major capital projects can be put under contract and delivered in a more expedited manner. And so I'd be more than happy to take any questions at all at this time.
Thank you so much for that, Doug. And yes, please, let's get to the HICP's members' questions as well. Please fill up that chat, everyone. We're really looking forward to seeing your input, as well as always, we will be looking forward to receiving your information after, if we're not able to answer your questions at these times. So please, if anyone would like to take the mic.
And Alex, I'm going to need your help a little bit if you could on tracking the chat. I don't have the capacity to follow the chat
Actually,
right now.
great. Actually, let's get started there. Pamela writes, I see that the RFP describes the size of the project, but what about the desired uses of the project, i.e. affordable housing and other priorities uplifted during the 2018 to 2019 community meetings?
That question is centered very squarely on the feasibility study. So the feasibility study, and I don't want to speak on behalf of the CEO group that actually has been involved in this process for over 3 years. But there are scenarios for development, and the scenarios for development, every single one of those scenarios incorporates not only an affordable housing component, but what we refer to as a very aggressive affordability component. So you have not only the number of units is in play, but the number of units that is in play is absolutely substantial. But then there's another element to affordability and affordable housing, not just the number of units, but at what level. Is this 30% of AMI? Is it 80% of AMI? That type of thing. And so an aggressive component is the most number of units at the most affordable level. And those are scenarios that are absolutely incorporated in the feasibility study. The feasibility study is going to be the basis for much of the parameters upon which the developer proposals will be assessed, evaluated, and eventually the selection would be made.
Thank you. It's nice to know those efforts will be maintained. I see, let's go to the next question, but I see Ivan Matthews' hand raised. Ivan, would you like to provide us some more information?
Sure. Thanks, Alex. And thanks everybody for participating today and listening to Doug's presentation. We're really excited. Doug's on board and is going to be moving forward with the next steps after the feasibility study is complete. Pamela, to answer your question, yes. So just to reiterate what Doug said, especially at the end of his talking points, the proposed uses, desired uses, the community needs are going to be incorporated into the feasibility study report back, which is going to be part of the RFP. So the developers or proposed development team respondents are going to have the same level of information that we've been working collaboratively with you and the Community Engagement Steering Committee and all the other community members.
Thank you so much for that, Ivan. I see Ari's hand raised. Ari, would you like to take the mic, please?
Yeah, so I'm wondering about the funding that you mentioned. Is that funding to conduct the RFP or actually funding to do the redevelopment? Or both?
I'm sorry, could you repeat the question?
You mentioned that there's going to be a motion for funding at the Board of Supervisors, I believe, next Tuesday. My question is, what level of funding is that? Is that to conduct an RFP? Is that to proceed searching for funding?
It's actually a minimal amount of funding to request assistance with the development of the RFP draft. So there's a subject matter expertise that we're bringing in with respect to how these evaluations can be assessed in a way that maximizes the public value of the assets. We're also having additional discussions on what we can do as part of the RFP process that might minimize the post-selection negotiation with the selected developer. And these are all elements where we're bringing in subject matter expertise at this time to build into the RFP. It is a minimal amount of funding that we're asking for, and it's just for that level of consultation.
Thank you, Doug. Thank you, Ari, for your question. Pamela writes, has the General Hospital Subcommittee approved the motion for the RFP? Actually, my apologies, Pamela, I see your hand raised. Could you please take to the mic?
Yeah, thank you. No, thank you, Ivan and Alex, for those clarifications. I think that's where I'm a little stuck. It's just on the process of it. So Ivan and Alex, this motion is just asking funding so that you can create an RFP. But it's okay. And in that funding and you get the funding approved, what will be once again that timeline in which you will identify these consultants and then these consultants will develop the RFP? Can you just walk me personally really on you identify these consultants, but then when will the point of the feasibility study be connected? Because it's what's in front of us really just tells us a biannual basis on the progress and timeline of confirming the use of funds, but is that the funds just for the job of this RFP consultants? I guess it's unclear how all of these things come together.
Yeah, not a problem,
Walk
Pamela.
it back again.
Let me jump in a little bit. So are you referring to a board motion right now that you're looking at?
Yes, that's the information that's in front
Not a
of
problem.
us right now.
So what Pamela, to the audience, the greater audience, what Pamela is referring to is a board motion. That's a request for some funds for us to secure consultation to assist in the creation of the RFP process. There is the source of those funds come from a program in which the guidelines for that program ask us to report back to the board on how the program funds, and specifically the project for which the program funds have been allocated, how they're progressing. So that's what that biannual report is it's a report back to the board on how we're using the funds that we're requesting with respect to initiating the contract with the consultant. The contract with the consultant is severable entirely from the selection of a developer. Okay, the developer that gets selected will not be part of this consultant group. The consultant group that's being hired is specifically on a very limited, very well defined role to assist in the creation of the RFP document. The RFP document is first going to have a rough draft, think of it that way, a draft of the RFP. And in that draft, we will then have internal discussions as to how we have positioned and incorporated the feasibility study. It certainly will be an exhibit into the as part of the RFP, but what we really want to do is, this is a tremendous document, this feasibility study, and we want to bring out of that feasibility study certain parameters upon which the RFP is promoting the assessment of those prioritized items in the feasibility study. And so we will have a rough draft of the RFP. That is going to be, and that's really the formatting of the document. The purposefully, that is occurring ahead of the feasibility study. The feasibility study would then be released and it would be finalized. We would then be able to incorporate that as the exhibit. We would then be able to have discussions about whether or not we have, in the rough draft of the RFP, we've maximized the parameters that are being promoted in the feasibility study. And we would be able to do any fine tuning at that point. And we hope, and right now we're looking at possibly the month of May for that fine tuning, where we've got the combination of the two efforts. That would lead us to an actual final RFP document being posted in June. And then once it's posted, then we get into the timeline for the developer community to create its responses and for those responses to be received and then evaluated. And that's what puts us somewhere in a selection process of the fall of 2022.
Thank you so much for that, Doug. And thank you, Pamela, for your question and your inquiry. It's really, it's very reassuring to know that there's so many efforts being maintained to stay true to the ambitions, goals of this process. So thank you very much, everyone, and on the HICP for keeping us all in check. Just lastly, I note that Teresa Velasco commented, please include a stop at LAC USC for employees to be informed. We all very much appreciate it. And yes, we are doing our due diligence to maintain proper communication and engagement with everyone, with all of our stakeholders involved. And with, I'll turn it over to my colleague, Heather. Heather Hayes, will you join us, please?
Thanks so much, Alex. And thank you, Doug, for the wonderful kind of overview of the RFP process and that board motion that's going forward next Tuesday. For those of you who have some unanswered questions at this time, the conversation is just beginning. We're very excited to announce that our first community at large meeting for this phase of the project, it's actually meeting number 4 in total, will be held on February 17th from 4 to 5:30 p.m. via Zoom. And we encourage you to join us there, to invite colleagues and friends to join us as well, so that we can answer your questions, be responsive to community interests and needs, and really update everyone on the status of the study, as well as what those next steps will be. And Doug will be back for more at that presentation too.
Thank you very much, Heather. Thank you.
Thank you again, Doug and Sophia, for your support today. And like I say, we look forward to continuing the conversation with you. So just some highlights of meeting number 4, as mentioned, coming up on the 17th of February. We'll be spending that time together to reorient the community on the purpose and the status of the study. We're going to update everyone on Supervisor Solis's renewed vision for the study and what those next steps look like. We'll definitely be reporting back on what we've heard from the community in our community engagement efforts to date and how that feedback and those voices have been incorporated into the study. We'll be outlining the future community engagement opportunities, spending time answering questions, and having a panel discussion of county agencies who will be able to reflect on larger county initiatives responding to community needs that have been raised through this study and other engagement efforts. Here's a quick overview of our agenda. Welcome Supervisor Solis's vision for the study, the presentation itself, a Q&A session, and then our county agencies panel with representatives from the Department of Public Works, the CEO's Homeless Initiative and Housing and Affordable Housing, and the LA County Development Authority. So once again, everyone here is invited, and we're asking for your help and support in getting the word out. Our social media campaigns are going to be launched next week. Our website is being updated. All of the information will be available there for you, and we ask for you to please help encourage community members and residents to join us on February 17th. We'll be continuing to reach out to you at these standing monthly First Friday meetings for the Health Innovation Community Partnership, doing upcoming presentations and making sure you have the most current information. We'll also be celebrating at the Wellness Center's 8th anniversary, which is slated for Saturday, March 12th, pending LA County health guidelines for around large gatherings. We also are delighted to come and present an overview of the study to any groups that you may participate in outside of this space. If you would like a member of the community engagement team to make a presentation, please reach out to either Alex or myself. Thank you so much. Now, we are late on time, but we have a really wonderful presentation for you next, so please stick with us. We're so delighted to welcome back this is not quite right. The tagline is not quite right. This is an Enhanced Infrastructure Financing District presentation by our colleagues at the Cosmont Group. With that, I invite Felicia to take it away.
Thank you so much, and it's great to see everybody again. We did a lot of work on opportunity zones together. Your input from the HICP and the subcommittee was instrumental in us getting that policy forward to the Board of Supervisors, which is where it is now. They are reviewing that, so I look forward to coming back and letting you know what's happening with federal opportunity zones, the county policy, and how we are going to derive community benefits from a federal policy, regardless of how difficult it is. We're going to do that. So now we have been engaged by the Southern California Association of Governments. This is part of the LA County USC hospital reuse study. This is one of the potential financing mechanisms for that. So the first district applied for a grant from SCAG. We were hired as part of that process, and I'm going to turn it over to my colleague, Joe Diegues, who's going to run us through what a tax increment financing district is. And you did see this presentation last year as they were applying for the grant. SD1 was successful in getting that grant, so congratulations, and we're glad to be back. Thanks. On to you, Joe.
Yeah, thanks, Felicia. Joe Diegues here.
Felicia's colleague. So since it's been a year, we thought it would still be helpful to review a lot of the subject matter. It's very technical and it's been a year. So as Felicia already covered, SCAG, the Southern California Association of Governments, has awarded District 1 with funding to assist in the evaluation and even the potential implementation of this tool, this EIFD, or Enhanced Infrastructure Financing District. We'll review what all those technical details mean. A big part of using these tools is for housing production, with a significant emphasis on affordable housing production. These funds came through SCAG from the Regional Early Action Plan funding, or REAP funding, which is almost completely focused on housing, and again, significant emphasis on affordable housing. SCAG has been a major player in the field of trying to implement these tools throughout the SCAG region. They've been successful not only in studying them, but actually forming these districts for purposes like affordable housing, other community amenities in various areas, including elsewhere within Los Angeles County, with the successful formation of that district in unincorporated West Carson just recently. There are others, just like processes have worked in those communities, the process proposed for the medical center area will involve a lot of stakeholder outreach and coordination, and that's why we're here. We're going to be seeking this group's assistance as this work unfolds. Next slide, please. Cosmont and our outreach partner, who is also on this call, the Sierra Group, we were selected by SCAG through a competitive bidding process. The idea is to coordinate and work in parallel with the reuse feasibility study. As Felicia mentioned, I'll mention it again, and I'll probably say it again during this presentation. The purpose of our piece of this whole stream of work line is to capture the value of whatever future private investment does happen here on campus, and capture value from that private investment to deliver these locally driven community and public benefits that HICP and related organizations have been so critical in putting in. So this is not, some land use document. This is certainly not some way to add new taxes. That is not what this is about. This is about capturing the value from whatever private investment does happen and use it to deliver the things that HICP and other community stakeholders have been emphasizing: affordable housing, parks and open space. We'll go through what the eligible uses are. Our scope of work has a significant emphasis on public outreach and communications. You'll meet our teammates at the Sierra Group shortly. And then we get into a series of technical work about looking different ways this district boundary can look. Very importantly, what are potential uses of the funding that get generate? And then where we would really like to get is the actual implementation phase, actually getting this district formed so that funding can be earmarked, set aside for these important affordable housing and other public benefit uses identified. Our analysis, this first phase of just feasibility, is slated through about October of this calendar year. And then our goal is to actually start the implementation phase of actually forming the district by the end of this calendar year. Beginning the end of this calendar year, our contract expires in June of 2023. A little review on the next slide of what we're talking about here. Tax increment financing, or you'll hear people say TIF. It's been around for a long time, since 1952. It used to be known as redevelopment agencies. That was the prior form of this tool. This is not that, and I'll go through a couple reasons why this is not that. This time around, the idea is you form a district and you freeze the property value at the time of district formation. And what you're saying is, as this value grows over time, in this case, as new investment happens in the campus area, what we're doing is very intentionally setting aside of those future revenues that will come from that private investment, and we're sort of protecting it. We're putting it in a special purpose bucket that's going to be dedicated to the things that are important to this community: affordable housing, streets, open space, utilities. This is an infrastructure tool, and that's one of the main differences to the old redevelopment agencies. This tool is all about housing, affordable housing, and infrastructure. I just have to reiterate, this is not a new tax, not an increase in tax. Residents, property owners, business owners don't see their tax bill change. This is really Los Angeles County and potentially the city of Los Angeles just allocating funds differently to make sure funds are going to be available for affordable housing and other public benefits. Can go to the next slide. I'll just hit some of the high points here. The whole idea of these districts is long term. The goal is to set up this district before the investment happens on the medical center so that we are set up to capture that value. But it's a long-term district anticipated to be in place 45 years or more. Governance, it's a little bit different than the old redevelopment agencies. It's not just a city council or a county board. There are actually members of the public that will be appointed to sit on the governing board. And it's a big part of why the outreach up here, up front in the evaluation phase will be so important, because this will end up with actually having community members sitting on the board that governs this district. There are no specific public votes required to form this district, but there are absolutely a series of public hearings that are required and the opportunity for folks within the boundary to protest the formation of the district if the plan is not, is not satisfying those local community folks, the property owners and residents within the district boundary. The projects that can be funded, it's very important, again, different from the old redevelopment agencies. We can only fund infrastructure and affordable housing. We'll show you some examples, but again, just at a very high level, private investment comes in to build new buildings or rehabilitate the underutilized property. That value grows the revenue stream to the city and the county and the other entities like school districts that receive a portion of the property taxes. And this mechanism is just a way for the city and the county primarily to direct some portion of those future revenues into our desired uses.
Joe,
Affordable
if I
housing,
can interrupt for a quick,
infrastructure.
Joe, can I interrupt for a quick second? Can you
Please.
explain a little bit what school district exempt means, please? Because that's a very important point.
Absolutely. In the old days, school districts, their future property tax revenues could be claimed by this type of district to pay for the district's projects. This time around with this tool, EIFDs, the district cannot take any revenues that would be, any future revenues that would otherwise go to school districts. It's basically required by state law that they cannot participate even if they wanted to. The school district funding could only increase. It could not decrease. That's one of the main differences in these EIFDs. That's what we mean. So we can continue to the next slide. We're gonna really focus on some of the differences here. The slide I'm looking at is slide 7. Well, I guess we can talk about slide 6. We kind of covered this, but just to reiterate, this is not a new tax. The idea is capturing the value that comes about from new future private investment and just setting aside a portion of those future revenues. That's what we're talking about. I'd like to move on to the next slide if that's okay. We find it very important to draw the distinction between the former redevelopment agencies because it's sort of understood in the economic development community that some jurisdictions sort of abuse the old former redevelopment agencies to do things that certainly are not consistent with what the new age of tools are authorized to do. So to draw some distinctions, the former redevelopment agencies, they were authorized to do a number of things. Infrastructure and affordable housing. They could also fund market rate housing, land clearing and parcel assembly activities, tax and other private business and developer subsidies. The new age, the tool that we're talking about here, EIFDs, again, very focused on public infrastructure, things like roads, sewers, open space, utility capacity improvements, and affordable housing. So much smaller focus, much more focused than the old redevelopment agencies. In the old RDA days, you had the ability to use eminent domain or condemnation of property. That is not allowed for EIFDs, the tools that we're talking about today. Eligible areas in the old RDAs, you had to qualify by different measures of blighted communities. For EIFDs, there's no blight finding required. We have some flexibility about how to draw boundaries. And governance, I believe I covered. It's not just a city council or a county board governing. This time around with EIFDs, there's this hybrid public financing authority that is set up to govern it and it very intentionally includes at least 2 members of the public appointed to serve alongside elected officials. Formation, the old RDAs had a governing body vote required to form. This time around, there are at least 3 public hearings required that require significant newspaper and mailing and website notices. And that the third of those 3 public hearings, there's a majority protest opportunity where landowners and residents within the boundary have an opportunity to say, you know, no, we don't like the way this is going. We're going to shut it down if that's the case. Next page, when we talk about what projects can fund, you know, infrastructure is such a broad term, just so we can expand what we mean by that, what the law says is included as infrastructure: water, sewer, stormwater, flood control infrastructure, roadway, parking, anything sort of TOD related, connectivity, bicycle structures, pedestrian connections, parks, open space, recreational improvements, childcare facilities, libraries, remediation of contaminated land. Affordable housing is a very explicit call out. More recently, the tool has been augmented to include things like broadband connectivity, improvements to address climate change, wildfire prevention, spread of infectious diseases, sea level rise. We're seeing the list of infrastructure get expanded a little bit within the realm of infrastructure, but also addressing, you know, today's age, things like wildfire, spread of infectious diseases. And then very recently, June of last year, 2 additions were facilities used by small businesses and nonprofit facilities. So we can think of things like facade improvements for businesses, or the funding of things like homeless shelters or other nonprofit facilities. So that's new, and that can be relevant. So that's new as of June of 2021, included in the law now as what the EIFD can pay for. So what you're not seeing here clearly is like market rate development, you know, auto dealerships, big box retail. Those were all things that redevelopment agencies can fund. It's not part of the game today. The work's been happening, just super briefly on the next page, all across the state. LA County has been one of the leaders in facilitating the formation of this district. LA County has also been on the end of the spectrum where they are requiring, even though the EIFD law does not require setting aside funding for affordable housing, LA County has gone beyond the law and said, you have to set aside at least 20% of the funding generated for one of these tools for affordable housing uses. And so even if cities are trying to do these districts within the county, the cities have to also meet this obligation. So LA County has been the leader, but they're going on elsewhere, and they vary. Some of these are very affordable housing focused. Some of these are very, you know, water and sewer focused. Some of these are TOD focused, but they are since 2014 when this tool was authorized, the growth in their implementation has been exponential. So we'd like to spend a moment on the following page on outreach, because that's going to be an important part of it. When we say this feasibility and certainly the implementation are going to require outreach and interaction with HICP, we want to tell you a little bit about what that means, and I'll ask for some help from Rebecca Brontes, our partner at the Sierra Group.
Thanks, Joseph. Can everyone hear me? I'm assuming yes.
Yes, sorry, absolutely.
Okay, no worries. I kind of heard crickets. That's a little disarming, but I'm glad to see everyone's there. Well, good morning. And what you see here before you is really an aerial view of the public involvement process for the EIFD. Our scope includes several meetings during the technical analysis that Joseph has presented this morning, all the way through the district formation. You know, our first task is really to design a community-driven process for the public involvement plan itself, which is now being written. The importance of all of this process is that it runs in parallel to the technical analysis that Joseph presented. And that's also in coordination with the HICP as well as the hospital feasibility study, in that it's inclusive of all those stakeholders and the input that has been received there, as well as others who live in and around the campus. Our scope includes 2 focus groups, 6 community meetings, and 2 public workshops spread throughout the EIFD technical analysis, which is shown here. in the slide. And there's going to be informational materials, updates, other engagement content that is shared via the webpage, social media, e-blasts throughout the process. That's shown as by the blue arrow on the slide. So I've separated this timeline into 3 phases. The first phase is assessment. This is where we have a focus group and 2 community meetings. It's the first step in the process where we inform and listen to our stakeholders in the community. We cover the key points of what an EIFD is and what it is not. You know, as Joseph has explained here, it's not a new tax. It's not the community redevelopment agency. It's not eminent domain, et cetera, et cetera. It's not a tool for displacement, but rather it's a tool that works for community benefit and showing the different types of improvements that can be financed that Joseph has presented here and maybe some others. We'll discuss the area that's being considered for an EIFD and get feedback on that. We feel like having these conversations really focuses on a good place for beginning to discuss community benefit itself, what potential benefits the people who live in the EIFD want to have there. And indeed, as we heard very clearly from the supervisor's office, from Jose Gardia and Guadalupe, I thought was so fantastic. It's kind of become our watchwords. You know, we want people to walk away with the opportunity to maximize their values and their benefits for the people who live there. And indeed, we want to start there, but we want to finish there as well. So we continue the involvement of stakeholders through the 2nd and 3rd phases. The 2nd phase is really actually talking about community benefits. These are the proposed infrastructure projects that we have taken through a fiscal analysis, and then talking about the next steps in the EIFD formation process and how to stay involved. And then the 3rd phase is the actual process for the proposed EIFD for the LAC USC reuse project. And that takes place in September 22nd all the way through June 2023. And again, it continues with, you know, community meetings and a public workshop. Also here, very key in the conversation is the discussion of community membership in the Public Financing Board, and also the public hearings that are going to be upcoming, including the County Board of Supervisors actions. So that's pretty much a basic overview of the framework. As I said, we're going to be developing a more detailed public involvement plan, including identifying the stakeholders to be involved in the different kinds of meetings that are taking place during each phase of the EIFD process. And I'll be glad to answer any questions and take any input. Thank you.
Yeah, thanks, Rebecca. So that's our presentation. So the next steps for our team are the technical analysis and public outreach activities in parallel, as they will inform each other. The goal, again, is to see the technical analysis portion of this about feasibility evaluation through approximately October of this year, 2022, including monthly briefings with a subgroup of HICP, I think, to be formed, in addition to the community meetings and focus group meetings and public workshops that Rebecca just outlined. And then again, if we get to the implementation phase, if feasibility is looking good, actual district formation starting end of calendar year 2022 and throughout the beginning of 2023. That's our scope of work. A lot of detail, so we are very happy to answer questions here and fully expect an ongoing dialogue as we do our work. Thank you for the time to present.
Thank you all so much. Thank you, Joe, Felicia, and Rebecca for your presentation today. I do apologize to the members with their hands raised. As we are running so tight on time, I'm going to ask if you could please put your questions in the chat and maybe we can be responsive that way. Of course, this is once again just the start of a conversation, the start of a dialogue. I know we will be inviting you back at future meetings. We'll be working to help put some of our HIC members into the subcommittee that you'll be working with, and we look forward to those public fora. I do want to conclude today's meeting with a final presentation from our very own Maria Brenes from Inner City Struggle, who'll be sharing with us some highlights from the LA City redistricting process. And thank you so much for your patience, everyone, with running a little bit behind time. But Maria, please close us out.
Thank you. And I will keep this very brief. Good morning to everyone. Yes, I was asked to share more about key updates and outcomes from the Los Angeles City redistricting process that concluded last year, and it was a 1-year process. And as many of you probably know, every 10 years, the city of Los Angeles is required to redraw boundaries based on the US Census findings. And you probably recall that the census occurred in 2020. And there was many challenges in that census process that impacted our community. One being the pandemic, and which made the outreach and the education process very challenging. Although, you know, there were many community organizations and trusted messengers who did so much work to try to reach as many of our community residents as possible. Also, the previous presidential administration and the fear mongering targeting immigrant communities in particular was a big challenge in terms of participation. And so we, do know that there was an undercount, particularly in low income communities and immigrant communities and communities of color, given the challenging political and health crisis landscape that we were faced with. And then the data, the census data was very, very much delayed. We didn't get data until the fall of 2021. So the LA City Charter again requires that district boundaries for the city council be drawn so that each district is as equal in population as possible, and so that communities have equal access to political representation, and that communities, particularly communities protected under the Voting Rights Act, have the ability to elect a candidate of choice. So in this process for the LA City, there is a 21-member redistricting commission that is advisory, that is formed from members of the public, that makes recommendations on a redistricting plan to the city council regarding the new boundaries, and the city council makes the ultimate decision on the final map. So last year's process was over a year, and some of the highlights is that there was robust community participation. Almost 15,000 residents in the city of Los Angeles participated in some shape or form, written, oral, comments, and participation in the virtual meetings. All of that was over approximately 15,000 residents, which was more than in the previous redistricting process. And what was really great is that the public had the opportunity to submit a map, and there was data, software to be able to do that. And the redistricting commission received 380 public maps, and those maps were used as starting points for what was ultimately submitted to the city council. I have some pretty close knowledge to this process because I actually was appointed by the mayor to serve on the LA City Redistricting Commission. So I was very much a part of that process and got to learn so much about the diversity, the great diversity of our city, and the deep inequities and the areas of unity and the areas where we still have a lot more work to do to come together as a city. I was really proud of the high and robust participation from East Side residents in the process, residents from Council District 1 and Council District 14 in particular, very much speaking about the strengths, the assets, the dreams, the aspirations of East Side residents. So, you know, the map was approved. It's now in, you know, in effect. And some of the significant changes that impacted our community in particular here in the East Side of Los Angeles is, well, overall, one of the historic pieces about the map is that Koreatown is finally united in one council district, CD 10, 100,000 residents. So that had implications for boundaries across our city. CD 1 and CD 14 remain majority Latinx citizen voting age population districts. And so the VRA rights of Latinx voters remain in place. And something that was very strongly uplifted in public comment from East Side residents was the unification of the historic East Side, Boyle Heights, El Sereno, and Lincoln Heights. And so there was a lot to balance, just given the population that needed to be as even as possible, although there's some room for deviation. But one big change for CD 14 in CD 1 is that a significant portion of Lincoln Heights that's most adjacent to Boyle Heights is now under Council District 14, including Lincoln High School. So that's one significant change. But I think overall, it was just very amazing to see young people, you know, immigrant residents, longtime residents of the East Side really speak up about their community and be part of this very important, significant process that is in effect for 10 years and will be a building block for equitable representation for our community. And I think that's very significant for the work that we're doing here in shaping development for the very same residents and for their access to opportunities and resources. So yes, thank you. Thank you for allowing me to share this exciting and historic update.
Thank you so much, Maria. Yeah, it's very interesting to see how the landscape of our city is being reshaped by these policies. And it's so important that we have leaders going forward to kind of advocate and make sure that, you know, we have an equitable framework as possible. We are truly at time. We have a couple of questions in the chat for you as well, Maria. You could take a quick look, one from Ari, talking about protected groups and an effort to establish majority representation for certain groups in the city. And then also, I think just, you know, why redistricting? You know, why to redraw districts drastically, even if the population distribution has not changed much from previous periods. So some interesting conversational topics there. I want to thank everyone for your patience and attention today throughout our HICP meeting. As is often true with our meetings, we have so much fabulous conversation and many, many important presentations to bring forward to this group. We thank you again for your time and attention today and look forward to another wonderful meeting in 1 month's time. But before we leave, just a quick announcement. As mentioned previously, we are hoping and looking forward to an 8th anniversary celebration for the Wellness Center. Our scheduled date, a target date, is Saturday, March 12th, and we certainly hope we'll be able to proceed with that date. We'll be doing, some outdoors activities, and we'll hopefully be doing some touring of the facility with the lens of the General Hospital feasibility study. We invite all of your participation and hope it'll be a beautiful day that we can celebrate together. Thank you so much. We'll see you again, hopefully at the anniversary day, and then in 1 month's time on March 4th for our March HICP meeting.